Good afternoon. I'm Jack Hatch. I'm a state senator from Iowa. Across the country, people are struggling under the burden of soaring high costs of health care, and it's reflected in our state budgets. We've done what we could to muddle through the problems of trying to find access and affordability for all families in this country, but states cannot do it alone. Today, we're here to have a new discussion with the members of Congress and with the White House so that we can move this country forward and come out and have a national plan by the end of this year. I'm very pleased to be here with my friend and colleague, Senator Tom Harkin, and the congressional representatives, Representative Kagan. I'm part of a delegation of state legislators, healthcare leaders in our state, who have come to the Capitol to express our outrage and unwavering sense of urgency that Congress and the President need to take to engage and to finally pass a comprehensive and meaningful health care bill. We are here by virtue of the Progressive States Network, a national organization for legislators that provide resources to us on many issues. We've been here because we're about to present a letter authored by Progressive States Network, signed by over 700 state legislators from 47 states, with a simple message: we need comprehensive health care legislation now. At 3 o'clock this afternoon, I will be heading a delegation of state legislators to the White House. The White House Working Group of State Legislators for Reform will be meeting with Secretary Sebelius and Healthcare Reform Director Nancy Ann DePaul. We'll be bringing that same message to them, that states can no longer carry the total burden of healthcare reform, that we got elected just like they did, on a promise of providing health care to everybody. Many states have moved forward. Many of the state leaders you have here today are people who have taken bold steps in providing progressive, universal, and comprehensive care to their legislature, getting it passed, and including more people with health insurance than ever before. Our simple message, and I'll read from the letter itself, is, quote, "Our disjointed healthcare system has formed a chokehold on our country, on our economy, limiting job opportunities, job growth, economic development, and simply, we cannot fix the economy without fixing health care." Senator Harkin, we present this to you as a strong champion of health care reform, a letter to you and the members of Congress and to the President of over 700 legislators asking for health care reform. And not just any kind of health care reform. Health care reform that's meaningful, and health care reform that includes a public insurance option.
Very impressive. Well, all I can say, Jack, is I wish I had you and Congressman Kagan and all these other state legislators on our committee. Then we get it done. Well, Senator Hatch, first of all, thank you very much for this, but also thank you for your great leadership in my home state of Iowa on all of the issues dealing with families, children, health care. You can't find a more progressive leader than Jack Hatch in the state Senate in Iowa. To my friend Congressman Kagan, thank you for all your help on the House side. I just said I sure hope that you're pushing hard over there to get this public plan, and he said they are. And to all my fellow public servants and elected officials who are here, just thank you for your tremendous leadership, and thank you. Thank you for doing this. Over 700 have signed this letter, 47 states, 53 legislators from my home state of Iowa. Thank you for your outspoken support for a public plan. And this is very meaningful, what you're doing here and what you're going to be doing at the White House, because I can assure you, as I'm sure my friend can assure you on the House side, there are powerful forces at work to try to keep us from having a public plan. The insurance companies are lined up, and they are coming at us with no holds barred to prevent us from having a public plan. But as a consumer, you know, it doesn't matter if you're shopping for a car or a washing machine or health insurance. Your best bet for getting a good deal is if three things are present: choice, competition, and information. And that's exactly why Americans need to have the option of a public plan as they shop for insurance in this new regime. A public plan would ensure real choice, something that's lacking in many parts of the country where some private insurers have a virtual monopoly in individual and small group markets. A public plan is about making sure that there is competition, again, as I said, in many places where it's lacking. A public plan is about insurance portability, having at least one plan that's the same no matter where you live. And if you move from one part of the country to another, you've got it. And importantly, it's about keeping down costs. A public plan would keep private plans lean and honest. And you would get the kind of information, that third thing, the kind of information to know what the public plan costs and what it covers so that you can compare. So a public plan would create a benchmark, a yardstick that consumers could use to measure whether private plans are offering reasonable rates and good coverage. Finally, a public plan is about efficiency. A public plan would lower administrative costs. They wouldn't have to spend a lot of money on marketing and advertising and high-paid executives and corporate jets and all that kind of thing. It would create a large enough pool of patients to offer lower premiums than is the case today. You know, there's always, if there's one principle in insurance that's inviolable, one basic premise in insurance: the larger the pool, the cheaper it is for everyone. And so that's what we want: a large pool, a national pool in a public plan. So taken together, these are extremely compelling reasons for including a public plan in our new reformed system. And most people I talk to see this as a matter of plain common sense. They want a public plan, and they want the private plans to competing head-to-head so consumers, as I said, have the information, and they can choose the best option for themselves and their families. So again, it's about choice. It's about competition. It's about the good old American way. And that's what a public plan is all about. And I can tell you that we're going to do everything we can to make sure that we have a strong, comprehensive, universal public plan in a health care bill that passes this year. But as I said, there are powerful forces working against it. And Jack, that's why you and all the legislators who are here and across the nation, you're doing this, I'm telling you, is very meaningful, and I thank you very, very much for that.